extremely excited today to launch Cottage Data2Go. This marks really the culmination of more than a year of data collection and analysis that included, as Katie mentioned, the community health needs assessment, phone surveys and listening tour, and also a large amount of secondary data analysis that we included in our community health needs assessment. During that process, we really learned a lot. We looked out in the community and looked for data coming from a similar time period, and we found some challenges in finding data. And we talked with the community. We heard that there were the same challenges amongst community organizations and community members trying to find data for the same time period and to compare it to different census tracts and different neighborhood level viewings. And we kind of hearing from that, it prompted us and led us towards creating Data2Go. Kind of taking a step back, before we dive right into the tool, we wanted to ask two questions of you. First, when you think about data, we wanted to ask, what does data mean to you? When you think of this kind of fundamentally, what does it mean to you and your organization, and what does it mean to you personally? When you think, some people may think of participant surveys or program surveys, or others may think of door-to-door surveys like the Community Health Needs Assessment or the American Census. And then once you have that data, what do you do with that data? How does that shape your decision making, and how does that direct your programs? So essentially, why does that data matter? So we'd like to ask those questions of you and share your answers of what does data mean to you and why does it matter? Yeah, great, thank you. So trying to understand data, what is it, wanting to collect it for a specific purpose, and how does that inform your practices? Exactly. Yeah. Anybody else? Any other thoughts?
Strategic plans, operational plans.
Yes, thank you. So strategic planning and forecasting and looking at trends. Thank you. And then right up here, sorry.
We want you to ask them, and what we should be doing.
Right. Putting it in context of how you're asking it and where you want to be going with your organization and with your program. Actually, for the sake of time, I think we're going to keep going. Thank you for those who've shared, and kind of keep in mind the answer that you had to those questions. Two things really stood out to us as we were thinking about those questions and thinking about staging this and setting this up. We thought, first of all, data drives our decision making. It's a critical part of our decision making process, as you guys touched on. It's how we steer our programs and how we guide what we're going to do and who we're going to reach. And it's really fundamental to our organizations and to our work. And then at the heart of what we're doing is that each data point is more than just a number. It actually represents an individual. And that's why we all do what we do every day, and all of that data brought together, it represents people out in the community, and something to just keep in mind. And those were two things that really stood out to us, and two kind of impetuses for us for when we created Cottage Data2Go. So what is Cottage Data2Go? I've referenced it several times now, and it is a free, online, easy to access mapping and data tool. It covers a broad range of indicators that speak to the well-being of Santa Barbara County residents. It covers the entire county of Santa Barbara County. It was based on a model in New York City called New York City Data2Go, and it's specifically for Santa Barbara County. It includes federal, state, and county level data. So anything from the American Census to FBI crime data to California EPA data, and even to data from local organizations. The Central Coast Collaborative on Homelessness shared their data from their point in time count, and we have that data in Data2Go. And the exciting thing about this is that it really is something that we want to grow over time. We'll update it annually, and we can add new sources. So as reliable and verifiable sources are presented, and community members and organizations are interested in adding that data, we'd love to hear your feedback, and we'd love to be able to build this and to grow it over time. Cottage Data2Go has many exciting features. Today we'll give a brief overview of the three main sections in Cottage Data2Go, and we hope that at a later time you'll take an opportunity to come back and explore some of the other features in Data2Go. Those three main sections can be found in the top left-hand corner of the screen. Those are Maps, Dashboards, and Connections. You'll see other features over here on the other side, including Features of Interest, About section, Downloading data, how to stay connected with Cottage Population Health, sharing links in the data, and then contacting us if you have any questions. We'll start in maps. Data in Data2Go is displayed in two main ways. First, in a city or town geographic unit, also known as a census designated place or a CDP, or it's also displayed in a census tract. Census tracts are units that cover the entire county versus a city or town or a CDP, which covers select areas of the county. We'll start with an example that shows the city or town geographic unit. If you come to the top left corner and select an indicator, if you move to Safety and Security, and just picking randomly here, we'll select Aggravated Assault. You can see that data is displayed in the city or town view, or what's also called the census designated place. In Santa Barbara County, we have 26 census designated places. These are incorporated or unincorporated areas of the county, and 8 of those are incorporated, and unincorporated areas are areas of the county with concentrations of the population with locally understood names and boundaries. So an example of this would be Mount Montecito or the Summerlin area. We can see that on here, data is displayed up in Santa Maria, Lompoc, exhibiting those 26 census designated places. From here, we'll view the data by census tract. In the top left corner, we'll select an indicator. Under categories, select Work, Wealth, and Poverty, and a list of indicators or variables appears for that category. If we scroll down, we can select Child Poverty, percentage of children under 6 in households with incomes below poverty. The Child Poverty Indicator displays data by census tract. In Santa Barbara County, we display the data by 87 census tracts that cover the entirety of the county, all of the geographic land area. And these subdivisions of the county are set by the U.S. Census Bureau for the decennial census, and they are intended to include approximately 1,200 to 8,000 residents per census tract, with the optimum size being about 4,000 residents. You'll notice that when in the map section, we have essentially 3 main sections of the display. On the left, we have a graph over here, which lists each of the census tracts in order from highest child poverty to lowest. And we can cursor over to see where these individual census tracts are located on the map. On the map, we can scroll over, and in yellow, we see the census tracts highlight and their corresponding percentage highlight as well on the graph. If we zoom in to the city of Santa Barbara region, we'll be able to see some of these smaller census tracts. And we'll notice that right now we have the west side of Santa Barbara selected, and that's indicated by the pink selection. And in the upper right-hand corner, we have some basic demographic data for the west side. If we cursor to the census tracts next to the west side or anywhere else on the map, we can see how they compare to the west side. From here, we'll move to the dashboard section in the upper left-hand corner. In the dashboard section, this information is displayed by Census Designated Place, or CDP. You can change the city or town that is displayed up in the top left-hand corner, and you'll see a complete listing here. We'll stay in the Santa Barbara CDP for now, and you can also notice that you'll have a map over here where you can select, if you'd like to find it on the map instead, you can select the geographic area. The dashboard is meant to give a quick, at-a-glance understanding of various demographics so that they can be compared across that census, that CDP, or city or town. These individual modules, which are race, ethnicity, earnings, and income, are able to be modified. So if we select a category and we choose again work, wealth, and poverty, we'll be able to add a module. Adding a module, we'll be able to scroll through, and you'll notice that you can select any of these modules. We'll go to child poverty, percentage of children under 6 in households with incomes below the poverty line. If you move your cursor over this cross arrows up in the top right corner of that individual module, and you see your cursor turn to the black cross arrows, if we click, hold it, and then drag it into the gray area, and then release, you'll be able to come back into the gray area and notice that your poverty module, which we just selected, can be added to the dashboard. We can do this with any of the other indicators. We can move to employment, employed workers with income below the poverty line. Again, click, drag, and bring that into our dashboard. If we wanted to change a category, we could go to change a category, and then we can move to another section, such as education. Add a module, and then we can add in degree attainment, graduate or professional degree, percentage of all of adults 25 plus. Drag that into our module, and we've added that in. In this way, you can create a customized dashboard that shows an overview for that city or town of how they're doing, and you can compare that to other cities or towns. For example, if you scroll over this graph, you can see how Santa Barbara compares to Summerland, Ballard, Carpinteria, Solvang, Mission Canyon, Goleta, Toro Canyon for this particular indicator. The pink indicates the city or town that we're on right now. You can also see the Santa Barbara County average, and then you can see this across the other variables that we've pulled into our dashboard. We'll move now to connections. Connection shows a correlation or connection between two different variables or indicators that we've selected. We'll come up here in the top left-hand corner to show what the connection or correlation is between. So for example, we'll start by selecting a blue indicator, which also corresponds to the x-axis of your graph. We'll come down and we'll select child poverty, again under poverty, percentage of children under 18 in households with incomes below poverty. Then we'll move to our yellow indicator, which corresponds to our y-axis. On the yellow or y-axis, we'll select under education, completed at least a bachelor's degree, percentage of adults 25 plus. We'll see when these two indicators are pulled into our table that there's a correlation that exists. And you can read a brief statement up here in the top left-hand corner as well as seeing the R coefficient. That's calculated for that. The pink corresponds to the city that we've selected, and in this case, that's Santa Barbara. This data is displayed by city or town as it is in the dashboard. If we select another dot on this graph, we'll be able to see what city or town that is. We can also see that information over here on the map on the left, Vandenberg Air Force Base for this one versus our previous selection of Santa Barbara. You can see where they rank and then how the correlation exists. It's important to note that correlation and causation are not the same thing. We just want to put that disclaimer out there as a note because causation is something entirely different than correlation. Correlation is just showing that a relationship exists, that there's a relationship between these variables versus saying that there's a cause of why one variable is dependent on another variable. If you have questions about that or want to find out more information, you can select this downloadable Read More Here brochure
that talks about the difference between correlation and causation.
I wanted to point out a couple of things. I had a couple of really great questions, and I'd love to kind of address those. One, Cottage Health did a tremendous amount of data collection last year, the Community Health Needs Assessment, and we're actually in the process of adding all of that data into Data2Go. So we will keep you posted on when that is actually added in, and there will be a huge number of variables added soon. So more variables coming soon, and also, you probably noticed that when you're in maps and then you move to dashboards and you move to connections, not all of the variables, the indicators, follow you over to maps and over to dashboards and to connections. And we would love to hear what you're interested in. We started with where we are at, and that is kind of a starting point. So we want to hear from you. Please jot down on that feedback form what you would be interested in seeing in dashboards, what you would be interested in seeing in the connections. I've heard a lot of requests of things for connections especially, so jot it down. We have a team who helped us to calculate all of those points and add that into Data2Go. And then there's also a way to see the source. There's an I button on maps, so you can see the source of all of the data, and it's on the graph side of maps, and you can get the data, and you can also download all of the raw data, so under the download section of the site. It is completely public access and free to use. We wanted it to be as easily accessible as possible.